This afternoon's session is, the title of is Working Together, the Whole Client. And this is a hypothetical. It's backed by popular demand. It went down really well at the last conference, so organisers have decided to do it again. The purpose of this exercise is to give you ideas on how to access services and highlight service issues through a practical hypothetical example. Now, during this will take quite a while, this exercise. You may want to take notes while we go. And when we do question time at the end of this, it'll be similar to the last time, but a bit different. We'll have a little bit longer for you to talk in pairs or in threes or whatever. Also, the Blue Angels will be wandering around with little post-its. We'd like to capture all the questions. Even if we don't get to answer them all by the panel, at least we'll have those questions and they'll be useful. We may be able to, I think in the post-conference proceedings, even be able to provide some answers to those. So your questions are really important. We really want this particular exercise to work for you. I'd like to introduce our expert panel. Firstly, representing the emergency relief volunteer and vulnerable groups is Susan McGee on my left here. Susan's, oh yes, of course. Sorry, go for it. For those of you that don't know Susan, she's the she's the manager at Casey North Community Information and Support Services. She's worked in the community sector for 24 years, holds a Bachelor of Arts and Associate Diploma of Welfare Studies, and has been with North Casey Community Information and Support Service for almost 15 years and developed the service from its inception to the busy crisis centre that it is today. Our second person is representing the alcohol and drug services is Donna Ribton Turner, and Donna is Director of Clinical Services at Moreland Hall and has an extensive experience in the health sector, including hospitals in Australia and overseas, mental health services and Department of Human Services. And she's also worked in the alcohol and other drugs sector for over 30 years. Our third representative is a Centrelink social worker, and that's going to be represented by Sharon Richards. She's the Manager of Social Work Services in West Victoria, including the Federal Department of Human Services. In this role, she has responsibility for the professional standards of social workers supporting individuals, families and communities. Social workers in this team are located in both metropolitan Melbourne and Western rural Victoria. Our fourth representative is domestic violence, and that's represented by Alison McDonald. Alison is a policy officer with Domestic Violence Victoria. This is the peak body for family domestic violence services in Victoria and provides support to women and children to live free from violence. I've got all my names all over the place, sorry. The fifth one and final one is a mental health, and that's represented by Jenny Cole. And Jenny's the home-based outreach manager of ARAFME, sorry, I got my acronyms wrong. And its role is to promote and improve the well-being of people affected by mental illness. Jenny was recently appointed as the outreach manager. Her early involvement in mental health was during the deinstitutionalisation period, where she was part of a team in setting up community houses in regional Victoria, which in part required forums and community consultations to ensure a smooth transition for the clients and their families. When integration with mainstream schools was implemented, Jenny was heavily involved in devising individual programs and advocating on behalf of children with special needs and their families. So that's our team, and we're going to be facilitated, not by me, that's the role of Kathy Langvot. Is that right? Is that how you pronounce it? Social policy researcher with Good Shepherd youth and family services. Now, Kathy has worked as a social policy researcher in Good Shepherd since 2005, and as part of that role she worked on the Under Pressure research project on emergency relief and cost of living in Victoria, and Women and Money, which was on low-income women and financial literacy. Kathy is a social worker and with experience in service delivery, management and service evaluation in both government and community-based organisations. So please could you welcome Kathy to take over and run the Hypothetical.
Thank you. Okay, here we go. So first of all, thank you very much to the panel. We're asking quite a bit of them today. They don't have a PowerPoint, they don't have scripted talks. We're flying by the seat of our pants, just as you have to do every day in your services. And so there'll be perhaps some detours along the way, there'll be some hypothetical questions, there'll be various avenues explored. And in the process, what we hope is that we'll cover a lot of the realities that touch you out there, but there will be time at the end, as Russell said, if we don't pick it all up, which I'm sure we won't. We have a scenario, and it's a fairly troubling scenario of a little family. Amber's 23, Phil's 29. They have a 6-month-old daughter. They live in private rental accommodation. They're both from New Zealand, but Phil's lived here for 5 years and is receiving New Start payments. Phil has a problem with drugs and he does find it hard to keep a job. Amber has been here 18 months and is only eligible for family payments as far as income security goes. They struggle to keep up with the rent and day-to-day expenses, not surprisingly, and often do not have money for food. Amber has no other family in Australia and does not know many other people. As they only have one car, she does find it hard to get out. So we're going to start Monday morning. And Susan, you're the volunteer in the emergency relief service. On Monday morning, Amber and Phil come to you for ER. They're struggling to keep up with expenses and they're out of money until the next week when Amber's payment arrives, and they're asking for assistance with food, fuel and nappies. What can you offer?
Okay, thanks, Kathy. Okay, so we've got a young family with a baby who have arrived at our organisation. Thank you. And they're looking for food, fuel and nappies. It's the first time, I gather, that they've been to our organisation, so I greet them, introduce myself and take them into one of the interview rooms, hopefully, that we've got, and have a little chat to them. I explain about our organisation briefly and what programs and services we have available, and then I ask them how can we help them today. So if they are advising that they need assistance with food, fuel and nappies, then I would probably want to know how long that assistance would be needed for. So when's the next payment that they'll be able to start affording to purchase food themselves? I might have the Centrelink e-confirmation service available to me, in which case I would get their consent form signed, and then I could have a look with their consent at their income statement and with them show them what income they're getting, when the next payment's due, and make sure that they are getting the right income that they're entitled to. And I would work out from there how long we thought that the emergency relief might be needed for. So if it's a week, then I would be looking at assisting them with perhaps some food vouchers. We might have some nappies in the storeroom, so I might do a bag of nappies because they're really expensive and they'll eat into those food vouchers. And if we've got some fuel vouchers, I would be hopefully able to assist them with those.
So that's terrific, Susan. I'm sure they'll feel really assisted. I'm just thinking about their overall situation, and it's not looking really promising, is it? I'm wondering if there's more you can do at the moment about their financial situation. I mean, would you think about referring them to a financial counsellor, or is that not relevant at this point?
Might be preempting. What I might do is I would take their details, so general demographic details, name, address, contact phone number, and some notes. And as I said, I'd already advised them what we've got to offer. And one of the things we've got to offer is a budgeting service. So maybe they would like to make themselves that are available to themselves, and then they could have a look perhaps at their whole situation, their income and expenditure, and their accumulated debts, and do we actually need to refer on to a financial counsellor, or can we just help them get back on track with a simple budget? Or is the fact that they just don't have enough income to service their debts?
And I guess that's assuming that there is a financial counsellor available without a waiting list of 6 weeks.
That's right. So we would then, if we thought that they needed a financial counsellor, have to look around and see what the shortest wait list was for that.
Okay. Well, oops, the news just got worse because when you went to access the emergency relief, you found that the last vouchers for the day had just been used by another volunteer, which I think is quite a realistic scenario. So what are you going to do, and what kind of priority do you think Amber and Phil have and their 6-month-old baby?
Okay. Well, I might ask my supervisor, push my luck and see if there's any chance of extending tomorrow's vouchers to this family, because I've seen that they, are in need. They've got a small child and they don't need to be racing around looking for emergency relief elsewhere. So maybe we'll be lucky with that, and the supervisor will be in a good mood that day. Otherwise, rather than sending them off with a list of places to go to, I might do a quick ring around of other local emergency relief services with me, in the room with them, and see if we can find them somewhere else that might be able to help with those vouchers without them having to go too far out of their way.
Yeah,
because I'm guessing the baby's getting crotchety by now.
And Phil's getting quite edgy too, actually.
Oh, it's typical.
So, yes, it's good that you mentioned that. There has been quite a lot of exploration of the issues, and, the baby is hungry. And Phil does most of the talking and seems to be in quite a hurry. So how do you respond to that? How do you try to engage with Amber, or do you not, as an ER volunteer?
Oh, as an emergency relief volunteer, I would be hoping to engage with all of the people that are in the room. I could engage with Amber by, saying, have you been in the area long? How are you finding it? How do you get around? You're out in that new suburb. You must be, hard, not much of a bus service out there. And give them our contact details, a pamphlet, so that if she wanted to call at any time, then she would have that information available at her fingertips.
Very good. Should we let Susan off the hook for a little while? That was very good. Well, luckily your efforts in ringing around the other ER agencies have produced results, and you are able to assist this family. And you've given them the information about how they can get back in touch, I noticed. So is there anything else you do at this stage? Do you collect any data?
Yes, I've collected the general demographics. They're general details. And I always like to grab a phone number, mobile phone number, a current one, just in case, that there's any reason that I might have further information that might help them, and I can contact them.
Okay.
Pass that on.
Thank you. Well, they're quite happy with that help, so well done. And they leave, and you go about your business. But a bit later on, you see Phil and Amber outside through the window, and they're arguing. Amber leaves, and Phil comes back in to the service. He's quite edgy, and he's demanding to see you again. He did feel that you listened, so he wants to talk with you again. He's wanting assistance with payment for his methadone. And the methadone program costs $35 a week, which is a lot on a New Start allowance. And he does reveal at this stage that he did not attend an appointment with his employment provider, and as a result his New Start payments have been suspended. So $35 is even more to find not on a New Start payment. So it's lucky Susan, the volunteer, is off the hook, but looks like Susan, the vulnerable groups worker, is on the hook again, because I'm thinking at this stage, as a volunteer, would you be taking this on again, or would you be directing it to someone else if you had someone else?
Well, that's a good question, Cathy. I might be from an emergency relief organisation that is lucky enough to have funding for a vulnerable groups worker, and in that case, yes, I might think that I'll go and see if that person's available. But not every emergency relief organisation has a vulnerable groups worker, so the volunteers in those situations would continue to provide the support that's being requested. So let's assume we do have a vulnerable groups worker, and I've gone to see and that person is available, thank goodness. And look, I've explained that the family's just been in, I've assisted, and now the young man's back. It looks like the young mother's gone off with the vouchers to get the supplies, but the young man's back and he's in need of assistance with his methadone program. So in comes the vulnerable groups worker, introduces herself, and did you say that?
Well, I'll just stop you there, and I'm going to drill in a little bit to this methadone payment situation. Would you always pay for somebody's drug of addiction like that?
It depends on the funding available, Cathy. Some organisations may have funding that would extend to such payments, and others may not. Has
your agency got a policy about methadone?
Yes, we do.
What's your policy, Susan?
Our policy is that if someone presents and they're in need of assistance with an opioid program, we would assist, particularly on the first time, because an opioid program is better than the alternative we see. And it is expensive. And so what we would do is assist on this occasion, because we do have funding. We're lucky enough to have some funding. And we'll talk to Phil about prioritising his methadone payments in the future, and perhaps even asking the chemist if they have a centre pay arrangement. So yes, we have been able to help him today.
Okay. I'm wondering if I could just ask Jenny or Donna at this point, is there anything else that you could offer by way of insight to Susan about somebody on a methadone program, and how might be a helpful approach, how might be a helpful way to approach them?
Well, Susan's definitely correct in prioritising his methadone payments, because we know that people on methadone are much safer. They've got less risk of getting bloodborne viruses, less chaotic lifestyle, so therefore much more able to support his family and look for work. So I'd be definitely encouraging Susan with the action she's taken, and perhaps suggesting she thinks about her local drug and alcohol service as another means of helping Phil and the family.
Jenny, any thoughts about dual diagnosis and mental health issues accompanying the other problems for Phil?
Yeah, I'd be looking into what history he's had, what other professionals he's had involved as well. I'd be looking at the option of him perhaps having a support worker, having an assessment done. There may be an underlying mental health issue going on, which is sometimes very hard to distinguish with the behaviour. So I would also be looking at trying to break down some of the concerns that are going on for the family that are being presented at this period of time, which we probably will tackle a bit later on. But yes, there would be the question of an underlying mental health issue going on.
Thank you. Susan, are you concerned about the baby as the vulnerable groups worker?
As the vulnerable groups worker. Now, I might have seen that family in the waiting room prior when they were waiting for the volunteer to assist them. And the young mum seemed quite capable and the baby looked to be quite happy, although it was getting crotchety because it had been waiting for a while. So at the moment, no, I'm not worried about the baby because the mother seems to be adequately caring for the baby and the father has taken the steps to get himself on the methadone program. So I'm thinking, no, the baby's doing okay.
That's good news. I'm just wondering, you've got a lot of demands in that kind of work, Susan. How do you find out about services like the Alcohol and Drug Service, the Mental Health Service? Do local service networks help at all, or have you not got time to get to one of those?
I know it's essential to go to local networks. And of course there's a local community information service that provides all of that information and it's always up to date. So if I can't find the service, I'm going to ring the local community information support service.
Oh, very good. Okay, well, what happens is that Phil does say that he wants some help with his alcohol and drug problem and that he would like to speak to somebody more qualified. He's found you very helpful, but he does think it's time to bite the bullet and do some more. And he's very worried about his New Start payments. He thinks he's might have blown it this time. And so he's really starting to get pretty anxious about that situation. So you're going to help him get in touch with Donna here. How would you do that, Susan?
Okay, so I'd have a chat to Phil about any support that he is already linked into or that he might like to be linked into, and what's available in the local area. I would encourage him to, check them out, and if he didn't like one, then don't give up. There's others. The first one might not suit you. So I'd give him the information and I'd ask him, would he like me to give them a call and see if there's any appointments available, what the process is, or is he happy to do that himself? So I'd give him the option. And if he is happy to do that now and he wants to really get onto it, we'd give the organisation a call. I'd get his permission to provide some basic information, and then perhaps if we can get to speak to one of the counsellors, I'd suggest that he speak to them there and then in the room to make that connection.
That's terrific, Susan, but I'm thinking the waiting room's getting pretty full. You've spent a lot of time with this client. Are you really prepared to spend more time with him, or could you just give him the phone number to ring Donna himself?
No, I think it's important to provide him with that support rather than just shuffling him out the door because the waiting room's getting busy. We can always take appointments and tell people to come back a little bit later, and then they will have their time as well for the support that they need. Okay. Looks like it's your turn, Donna, to try and help Phil. He's keen to talk to you. He's on the phone. He says that he has a problem with drugs and it's been over 8 years that he's been struggling with this, and he really needs some help now, some counselling, something, anything. What are the key issues arising about referral and support to a service like yours that should be in the back of our minds?
Okay. Well, with Phil, he's on the phone, so I guess for me, being the drug and alcohol worker, the main thing I'd really want to do is form some sort of engagement with Phil at that point to encourage him to actually make it in, because lots of people ring but don't necessarily get in. So I'd be asking Phil about what he wanted, but also noting that Susan told me he was a bit edgy and demanding, I'd be probably checking out what's happening with his methadone. I know methadone lasts about 24 hours, so is the edginess because he's starting to withdraw? Has he missed a dose? Has he been using heroin because he hasn't been able to pay for his dose? So I'd be checking that sort of thing out. I'd be checking out a bit of a risk assessment on the phone, how he's feeling about things. He could be edgy because he's in a bit of a mess, so it could be situational, but he could also be in withdrawal, or he could also be just things getting on top of him and feeling like he can't cope. And I'd be trying to give Phil an appointment as soon as I can, but there are waiting lists for services, including counselling. So I'd be doing a bit of a plan with Phil on the phone about what support's available in the interim if he has to wait a few days to see somebody. So I'd give him Direct Line's phone number because they're available 24 hours a day and you can ring for anywhere in Victoria for a free call, and they have trained qualified AOD counsellors on the line. Be asking about his relationship with his GP if he's got one, or his methadone prescriber. So just trying to put some things in place of people he could speak to in the interim. Where I work, we do have the capacity to bring people in same day for drop-in, and if that was required, if I thought he needed something more than that immediately, I'd do that.
Do you think he will engage with you?
Well, he's already demonstrated a real commitment to treatment through getting on methadone. He's engaged with the service provider, so yeah, I'd expect Phil to come in and see us, yeah.
That's good. Well, I don't know, can you do anything about his new start? That's obviously the most pressing thing on his mind.
Well, I'd be suggesting he talks to his Centrelink worker, but knowing that he has entitlements as someone in treatment, and he could get a lot more help around that by letting people know that he is actually having treatment. Yeah.
Okay. Terrific. I think you've covered all of the things you'd want to consider there, and you think he's got a fairly good chance of coming in for the appointment that you've just made with him on the phone. So that's terrific. I'm wondering though, Susan, because you're still in the room and the waiting room's still busy, but that's okay. I'm wondering what you're thinking about the New Start allowance and whether you can see any options there.
Okay. Well, I've noticed with Phil that as soon as we advised him that we'd be able to assist with his methadone, he did calm down a lot. So he was obviously quite agitated because he had missed a dose and he was wondering how he's going to access his methadone. So as soon as we said, look, we're going to be able to help with that, he calmed down. Now he's spoken to the Alcohol and Drug Service and he's calming down a lot more. But we do need to sort out this Centrelink income, and I am going to suggest to Phil that he has a chat to the Centrelink social worker and see how he goes there, and if he needs any assistance to come back and we can assist with some advocacy.
Okay, so you managed to set up an appointment for him, or he does that himself?
No, I think he can do that himself.
Okay.
He can pop down to Centrelink. So he's got his methadone organised. We've given him a cheque for that. He's organising some counselling with the drug worker, and I am now going to send him off with a task to go and see if he can get an appointment with the Centrelink social worker as quickly as possible. But if he has any problems, come back. And we'll
Terrific.
assist.
Well, that was Monday. So Tuesday dawns and Phil attends Centrelink as suggested and for his social work appointment. And Sharon, I'm just wanting to ask first, should he have made an appointment with you, the social worker, or is there somebody better he should be talking to that looks after New Start or disability or whatever it is that he might have?
I mean, given the nature of the vulnerability of Phil and what's happening in his life, I think it's quite appropriate that he access social worker, and there's a range of ways of doing that in our organisation. We have a face-to-face service that sits in our service centres. We have a phone system which also sits in our service centres. If there's not a social worker available, we can actually put the client on the phone to access a social work service. And we have our call centre network as well, where we have social workers involved in that space. But Look, Phil's come into us, and I guess what I'd be interested in doing with Phil is obviously looking at what are the reasons as to why his New Start payment has stopped, and what are some opportunities and options around ways in which we resolve that for him. I'd also be quite interested in hearing a bit from Phil about what services he's got in place already, or what systems or support. So if there is a need to wrap around some servicing for him to help support him in that compliance element of being eligible for a New Start allowance, we would try and factor that in as well. So I'd probably do some service mapping with Phil in regards to what services he's engaged with and how we can draw on some of the expertise that sits in those services to ensure that we have a plan, a participation plan that actually reflects Phil's needs at that point in time. So as Donna referred to, we have certainly have a lot of flexibility in looking at what is the situation for Phil at that point in time, and how can we undertake a participation plan that reflects that he's engaged with drug and alcohol counselling, or he may have other activity plans through other agencies that he's engaged with. So that mapping around what services are involved is quite important.
So participation plans and service mapping, that sounds terrific. But is he going to get his New Start allowance?
That's right. So what would happen is basically the role of the social worker is obviously to navigate throughout the system of our organisation, and obviously liaise with the experts who understand, I guess, the more finer detail around eligibility for New Start allowance. But our role is to advocate on behalf of the client and actually present the situation that's facing that client. So as of July 1st this year, the comprehensive compliance assessments, which is where a client has got a breach, if you like, will be sitting back in the service centre. So there are customer service centres. So the social worker in that space will be responsible for doing a face-to-face interview at the point in time that the client connects, and liaising with our participations team to negotiate. We don't have delegation to make decisions, but we can certainly advocate strongly on behalf of the client and present their case that fits within the language of our organisation sometimes and the way it operates, so how we can influence our staff as well in being more client-centric.
Oh, that's interesting. Do you want us to tell a bit more about the language of your organisation and how you... my experience is that Centrelink social workers, and what people have told me who struggle a lot with financial hardship, is that social worker is often the open door into Centrelink. That is Centrelink's no wrong door. And there are not always... there are some other wrong doors for people sometimes with Centrelink. So I'm interested in what your chances are in advocating for Phil with the other parts of your organisation. Do you think he's got a chance of getting his New Start back with your help?
Yes, I do think he has a chance of getting his New Start back. I think that I guess we've done a lot of work as a social work service within the organisation to, I guess, have that level of influence around presenting customer circumstances. We also do a lot of work with staff around training and development, and probably awareness building in regards to what is vulnerability, what does homelessness mean, sort of a range of issues around that. So we do invest quite a lot in our staff in understanding some of the, I guess, the impacts that those situations can present. Now, you know, like, I'm not going to say everyone's perfect in that space, but we social workers do have a role to advocate on behalf of the client internally within our system, and we also have a responsibility around what we can link people with externally. We also have community engagement officers that some of you might have met that work in the community that have a specific focus around homelessness and supporting people that are homeless. So they do a lot more out-servicing work. So I think the culture of the organisation is shifting to a much more client-centric approach.
That's great news. I'm going to ask you one more tricky one. I know you're a frontline social worker, so this might be a bit difficult, but you know, there's a lot of pressure on Phil and people like him to go out and get a job. Mm-hmm. Are there really jobs for people like Phil? Just answering as yourself now.
As Sharon or as a centrelink social worker? Yes, I actually do believe that there is employment out there for Phil, and I think there are certainly opportunities. I think certainly Phil has some challenges in regards to some areas of his life that he needs to manage, but we would operate from a strengths-based perspective, and we would look at the skills and I guess acknowledge the life that Phil's had and how we can utilise that and tap into, and what are some opportunities to connect with our job services to actually look at ways in which we can help influence that. So is that from a more vocational training element? So there are some range of options in that space, and we do link in where we need to with our job service providers.
That's great. I always feel more hopeful after I've spoken with Centrelink social workers. No, seriously, I do.
I was just going to, while I've got the floor, I guess one of the things that we've been really trying to look is how we can ensure access to a social work service, given that we don't always have social workers in every location or every office that we have around Australia. So we have invested quite a bit, I guess, in this sort of what we call a telephone access service. So if a client presents and actually sees a customer service advisor, and throughout that interaction there are issues that are highlighted, what that service advisor will do is pick up the phone, ring a number, and actually do a warm handoff to a social worker. So there's that immediacy around access, because what we learned was that our clients aren't very good at keeping appointments. We're best to actually meet them as they walk in the door, or have them access our service when they walk in the door. So our telephone access service is a national service. So you've got about 45, 50 people, social workers, who are available to take those calls throughout Australia. And then we have our call centre environment as well. So we've tried to move much to a case consultation model, where we will case consult with the client at the first point in call, whether that's face-to-face, whether that's over the phone, I guess assess need and priority around need, and we've created, I guess, a little bit more flexibility in regards to our ability to see people on those more urgent issues rather than always working from an appointment base. So I think that's actually helped to increase our accessibility with the finite resource that we've got, as all of our agencies have got.
Well, Phil really clearly has responded to your understanding, and he's talked a little bit more about his situation, and that he really wants to get his act together this time, and he hints that things aren't going really well with Amber at the moment. Do you do anything more about that at this stage?
I mean, we can certainly explore with him what the issues are and what he sees as the concerns or the tensions in the relationship with his partner. So we would probably do an assessment based on that, and then probably from that actually think through what would be a service that might be appropriate to refer Phil to, or whether there's some family relationship advice that might be appropriate for Phil individually, or Phil and Amber to engage together.
Okay, thank you. So just remind me again, what's happened about his new start as he leaves?
We've got his new start up and running.
You've got it?
It's up and running.
Woo! Okay, that's the best news. So that was Tuesday. Wednesday, we're back at the Emergency Relief Service. Surprise, surprise. Amber actually comes in this time, just with the baby, and she wants to see the vulnerable groups worker again. Well, she would have been happy with the volunteer too, but she's feeling really uncertain of herself. She's feeling still very worried about the money and about trying to survive on the family payment, the family tax benefit. And she's still struggling to keep up with the bills. She's quite emotional, and the baby's crying a lot. And this time she's actually asking for help with a pharmaceutical script for depression medication and more help for a bit more food and nappies. Can you help, Susan?
Okay. So the big problem with Amber and Phil's income is that Amber's only been in the country for 18 months, so she's not eligible for the parenting payment. She is eligible for family tax benefit, but that just isn't enough. And they rely heavily on Phil's New Start, which had been breached. So I have a chat to her and say, you know, do you know if Phil had any luck at Centrelink? And she's probably going to tell me, yes, it's been reinstated, but maybe it hasn't just hit the bank account yet. So definitely we would be able to assist with more nappies, because we try to make sure we've always got nappies, and medication. Our emergency relief agency has an account at the local pharmacist, and I'm fairly confident she's got a healthcare card, so she would be eligible for the reduced rate. She's asking for more food. We did just help them 2 days ago, so I might go at the back and see if there's a decent food parcel that's been made up, and maybe assist her with that and $5 for some bread and milk.
Okay. Are you worried about what she's told you about the depression, and are you worried about the baby?
Well, I'm not so concerned about the depression because she's obviously been to see her local GP, who's prescribed her medication, and seeing he's the specialist in that area, I'm going to assume as the vulnerable groups worker or as a emergency relief volunteer that she's in good hands there. And as long as she has her medication and the baby still looks like it's being cared for okay, I'm not worried about the baby at the moment.
I'm just wondering, Jenny, if I could ask you here, is that a fair enough assumption about Amber, if she's been to the GP and she's got a script and that it's under control as a mental health worker?
Yeah, I'd also be asking the question of what else has the doctor referred her to? Has he referred her or she referred her to counselling, etc.? Because I'd be very curious about what other supports are in place for her. There would be questions in my mind in regards to what support she has around her now to assist her through this. I'd also be wanting to know information in regards to has she had a history of depression before. So I'd be wanting to have some exploration around that, which would guide me as to which way to go. So assuming she hasn't had depression before, it's only now since having the baby. So there would be the question of postnatal, etc., and trying to find links for her. Yes, very curious as to whether she's actually got a counsellor, and if she hasn't, I'd be wanting to get something in place very quickly.
Yeah, okay, well, please.
Can I just add something there? As a family member of someone who has a drug issue, Amber would be entitled to counselling in the drug and alcohol sector in her own right.
Oh, okay.
Not all services have family counsellors. We do where I work. And we also offer single session work, so we could see her probably the next day for a one-off session with a family counsellor. But all drug and alcohol counsellors work with family members as well as the person with the drug problem.
Okay.
So she could engage with counselling with a counsellor at the same agency or another agency as Phil.
And if it was an emergency relief agency, how would they do that referral to you?
They could just encourage Amber in the same way they did with Phil to give us a ring, or often family members come along, so she might come along with Phil to an appointment, and the counsellor would ask, does she want to see somebody herself, either through just a single session or to actually engage with some counselling with a worker. And some people elect to do that as couples together, and some people do it separately, or a combination of both. Yeah.
And so if she doesn't know that Phil's spoken to you before, would you say anything about that to her?
If she came with Phil to an appointment, we'd be giving her information in the waiting room about how she could get support for herself, and we'd be telling both she and Phil about what was available as a family. So not only will we have the family counselling, but in the agency where I work, we have a play group for parents with under school-aged children to come along and engage in some social activity and support around parenting, which could be very useful for Amber and Phil and the baby. Yep.
That's great. Well, Amber now reveals to you, Susan, that she and Phil had a big row, which ended up in a fight, and he pushed her away, and she hit her head as she fell. So she has thrown him out and now does not know what to do. She is worried if he uses drugs again, he could be violent. So...
Oh dear.
Yes. The pressure, I think, the stress, you know, so many things going wrong. Obviously, it's a bit of an explosive situation at home. So,
Okay.
and it's right there in the counselling room, in the interview room with you.
Okay, so now the situation worsens. So we've got a young couple that have been struggling, have a baby, father with a drug problem, trying to overcome that, having problems with income. Pressure on their relationship has ended up in family violence. And this has opened a bigger can of worms because not only has Amber sustained an injury when she's fallen, but now she's also in the situation where she's thrown him out, and how's she going to pay the rent because she only gets the family tax benefit. So we'll look at her situation and I'll talk to her about that and suggest maybe it would be better if she spoke to the domestic violence organisation that's just down the road. They have a great worker there, and I think she would benefit from having a chat to them.
Well, sorry, go on.
And so I'm going to offer, if she wants, that we could give them a call and she could have a chat on the phone to the domestic violence worker or see if she can get an appointment with them.
Yeah, that's great. And it is lucky that there's a service not far away and that you know about it. Did you know that they also have an outreach that they will come to you sometimes if they think that that's needed? And I'll then ask Alison if that's a realistic option.
Well, we have been able to negotiate that in the past, but I wasn't going to get Amber's hopes up. So we'll call them first and we'll see how busy they are today.
So, Alison, how busy are you today, and how much of a priority is responding to Amber?
Well, first of all, it's fantastic that that the ER agency has a protocol and a relationship with its local family violence agency. If they didn't, they could always go and make a referral to the Central Crisis and Intake Line, the Women's Domestic Violence Crisis Service. But in this case, it's fantastic that they've got that relationship established, and so they know exactly where to go. In this case, it's we're very fortunate that we do have capacity this day to come and see Amber at the ER agency.
The thing is, for Amber, she doesn't have any transport, so the option would be to give her a taxi voucher, I suppose. But she seems to have the connection with the local ER agency, and I'm thinking that might make it easier for her to broach this really difficult area if she hasn't had to seek this kind of help before. I think the term family violence or domestic violence can be pretty scary, and I wonder if there's any gentler ways that you could approach that or make it easier for people.
She's going to have a risk assessment at some point in this process, and the vulnerable groups worker may well have had training and professional development in risk assessment and risk management, in the preliminary identifying family violence form of that, which would be fantastic, because then that worker could have that very initial discussion with her about what's going on in her relationship with Phil. One of the primary things that they would have to ascertain is her immediate safety needs. So this might be a conversation that happens when the worker comes. It may be a conversation that has happened before that.
Is there a process for you of working out what the priority issues are? You've mentioned safety. We also know she's isolated. We also know she's depressed. We also know she's financially struggling. As a DV service, how do you work with what is the top priority?
Well, when I come into the agency and meet with Amber, we have an initial conversation, and in that conversation I would be doing my comprehensive risk assessment, and that is the process whereby I will determine her immediate needs, her safety needs, look at some of her options and work with her about what steps she wants to take. We'd look at things like, is she at immediate risk? Does she need to go into a family violence refuge? Does she want to apply for an intervention order? That's an option for her. I can help her with the process for applying for that, and we can get in touch with a legal worker who can help her with that as well.
Okay. She does want to stay with Phil, she tells you, but without the violence. So she wants the relationship, but she wants him to stop his angry, violent outbursts. What are her options to be safe? You've mentioned refuge, intervention order.
It is possible to gain an intervention order that includes conditions that he can't use violence against her, but that they can continue to live together, and they can. One of the questions you might ask her is, in ascertaining how long the family violence has been going on between them, is whether the police have attended any family violence incidents between them before, in which case they will be in the system there. They can go through the police in that case to apply for what's called a family violence safety notice. But in this case, they may go through me, the worker, to help with applying for that intervention order.
Alison, I'm interested in exploring a little bit more the intersection between financial stress and family violence and financial abuse and financial stress and the ability of somebody like Amber to actually leave when she isn't financially independent. Are you able to unpack some of that a bit more for us?
Well, we know that that's a really critical issue when women are in violent relationships and they're considering their options for what to do. In a case like Amber and Phil's, she's financially dependent on Phil and his income. So her decisions about whether to leave him and to leave the relationship because of the use of violence can often very much come down to questions about her capacity to take on the family's finances. I mean, we know that women leaving violent relationships are one of the biggest cohorts of homeless people that women and their children are. So
there's a lot at stake.
There's a lot at stake. We know that women and children will live in their cars when they leave violent relationships. There's enormous sacrifices to be made, and that can stem on into sort of all sorts of disadvantage that come from dislocation and interruption to schooling and all those kinds of things.
Yeah. And I'm just wondering, Sharon, at this stage, is Amber eligible for any more Centrelink payment as a victim of family violence?
There's a process that Amber can apply through, and probably would if she was engaged with a family violence service or with other services, is that the Department of Immigration actually have the ability to grant permanent residency to people that travel from overseas on certain visas who are victims of domestic violence. So there is a process of Amber actually applying for permanent residency under the Immigration Act, and that assessment is actually undertaken by a Centrelink social worker who are quite specialised. They're specialised in that role, and there's probably 4 of them across Australia, mainly based in Melbourne and Sydney, because that's where the majority of people that migrate or here on temporary visas actually locate themselves. I guess I would just highlight that the definition of domestic and family violence in the immigration arena is very different perhaps than what you or I would understand domestic violence. It's a lot more pointed and a lot more linear, rather than actually having a fair bit of autonomy and flexibility within it. So I would be encouraging Amber through her domestic violence work or through her support systems to even look at engaging perhaps with a migration officer or a solicitor in regards to advocating and supporting her application for permanent residency under domestic violence.
So would she be better off with the immigrant domestic violence service, In Touch, I think it's called, in Melbourne?
In Touch. If that's what she wanted to do, and if the immigration issues were really key to the next steps that she took, they could certainly. They've got the expertise in the family domestic violence provisions under the Migration Act, and exactly what she'd need to do to go through that process. In getting in touch with a solicitor, as you suggested, Sharon, you'd want to make sure that they really understood the process, because it can be cumbersome.
And we're remembering at this stage she does want to go back. So it seems to me she doesn't have a lot of financial options unless she goes home to New Zealand. And then that's the end of the relationship. So she seems to be, to me, in one of those cul-de-sacs.
Yeah, and we also know in terms of risk that when women leave relationships, that this is one of the most dangerous times for them. Women often instinctively know this.
Yeah. So she is feeling, she's starting to feel quite desperate actually, and Alison, you're talking with her about all of these things, and she starts talking about perhaps it'd be better if she wasn't here, you know. She can't really look after her baby properly. She's can't seem to succeed at anything. And she actually isn't talking about going home. She's talking about being suicidal. So what is that something that happens in DV services much? That
Absolutely. Unfortunately, I've had the assist training. So as part of my conversation with her in risk assessment, I can do some suicide risk assessment, but at that point I'd probably want to re-engage with Susan, talk about whether Amber was meeting the threshold for a referral to the CAT team.
Okay. Perhaps you might like to engage directly with Jenny next to you.
Yeah.
and ask her.
Yeah, I've also had assist training. So assist training is really worthwhile, and being able to be trained and have the provision of, when you do come across someone who does have suicide tendencies, quite often we feel rather shy about people when they talk about suicide and wanting to commit suicide. Sometimes some people dismiss it and think, oh, well, you know, that's just a passing fancy. In my belief and in the training, it's taken seriously, no matter how much it is a line just thrown, oh, well, I may as well commit suicide and then change the subject. So in that, it's in part of the training, it's to establish whether she does have an established plan, and it is okay to talk about that. It's a duty of care position. So it's establishing whether she has a plan and whether she doesn't, and going through that. It's also to maybe get a little bit of the history as to whether anyone else in her family has committed suicide, because it's more of a tendency in that regard. So it's putting in protective measures for her and working out what protective measures can be put in place.
So are you able to talk with her on the phone as a mental health worker, or does the ER service really only have the option of calling the CAT team? You know, is it one thing or the other?
No, there are other options. There are mental health helplines. There are different agencies that can assist with that. Within my agency, there is a helpline as well. So there's lots of help out there and support that can be easily obtained.
So from what I've told you so far, Jenny, and if you were Susan and Amber was there talking about suicide, would you be ringing the CAT people?
Not at this period of time, because I don't have enough information.
Okay.
I would be ringing the CAT team if there was a genuine concern that she was at harm of herself or another, for instance, the baby.
Okay. So it seems like that's as much as we can do today. Amber's got a few supports sorted out. She's got some good people to work with. We're going to leave her and Wednesday, and it's Friday, and we're getting to the end of the week. We're getting to the end of the hypothetical, but we're not there yet. Because Phil comes in at 4 o'clock on a Friday afternoon to see Susan. He's homeless, which we can laugh about 4 o'clock on a Friday afternoon because we all know how real it is. But it's pretty tough for Phil. So he's got nowhere to go but back to Susan, and who's been so helpful. And he's desperate to know how Amber and the baby are as well, because he hasn't heard from them. What's happened is he was sleeping in his car, and he parked the car in a tow-away zone while he was at his methadone chemist. And now he has to pay $150 to get it out. So things are just going from bad to worse for Phil. But it's good he's come back to the local emergency relief service where he knows he'll always get help, won't he? Okay, so I have a question for you, Susan. First of all, he wants to know if you've seen Amber. So, what do you tell him? You get all the tough ones.
Well, I would say, look, Phil, even if I have seen Amber, I can't tell you that. And I can't tell you where she is. But if you want to leave a message for her, and if she happens to come in again, I can see if she wants to collect that message.
Yeah. Okay. And the homelessness, the car?
Phil. Okay, so now he hasn't got a car. And
you don't have to solve every problem.
No, and he hasn't got a place to sleep. So what's he hoping I can do, Kathy?
He's hoping that you can get him into some local emergency housing, just to tide him over till he can sort things out with Amber.
All right. Okay, Phil, well, we're going to call the emergency housing service. I'm going to have to be quick about it because they like to go home early on a Friday. Unfortunately, I know the worker down there, so let's hope that they haven't had enough for the week. So we will call together, we'll call the local emergency accommodation service, and I speak to Jim down there, and he tells me that...
no vacancies, Susan.
There's no vacancies.
Sorry.
But
no.
Because they work under the opening doors framework, Kathy, what he will do, seeing as it's now 4:30 Friday, is he will see if there's any crisis funds available and see if they can sort him out a motel for the weekend.
Terrific.
And then they'd make him an appointment on Monday morning.
What about his car? I'm wondering if a Nils loan could help with the car, the $150.
Okay, first of all, I'm probably a little bit more concerned about where's the emergency accommodation and is he going to be able to access his methadone?
Okay, good.
So I'll check that out.
Yeah.
And if it's out of the way a bit, I might be able to give him some Met tickets, or I might be able to assist him to negotiate some takeaway doses over the weekend.
Okay.
Now, a Nils loan for the car.
$150.
There's a couple of issues there. One is that there is no way he's going to be able to afford to repay a Nils loan. And the second issue is that he's homeless, so he's not going to fit the 6-month criteria of being in housing for 6 months. And also we don't lend Nils loans to get cars out of the pound. So sorry, Phil, that's not a goer.
Okay, he just heard about Nils loans and he'd heard they were fantastic, so he thought he'd ask.
But what we might do, seeing as it's 4:30 on Friday and you're probably not going to get it out of the pound this weekend, you've got to go and see the emergency housing worker on Monday and then come back and see me, and we'll see what we can negotiate in terms of getting the car out.
Okay. Did you want to say something, Sharon? I could see itching to help there.
One of the areas Susan might like to also explore with Phil is the eligibility for a crisis payment, given that Phil isn't at home and is no longer living at home and was a perpetrator of domestic violence. So crisis payment is 1 week's payment of his current payment on top of his regular payment. So that may assist with the car or some short-term housing if he gets in before 5 o'clock.
Yeah.
I was just going to say, Sharon, what time does Centrelink close on Friday?
I think we can almost knock off for the weekend knowing that Amber's got some good support links, Phil's got some good support links. We still feel confident the baby's fine, do we? Down there at the DV service, and yep, good. And the mental health, yep. But there's one more job to do before we knock off, and that's debriefing for the volunteer.
There's nobody with Amber.
Amber's in the house and she has a safety plan in place and the support of the local outreach agency.
Good question, though.
Thank you. Yeah.
I was thinking that myself, yeah. So debriefing for the volunteer, for the vulnerable groups worker. I think it's your job as the vulnerable groups worker to debrief the volunteer, but who's going to debrief you? Anyway, would you like to just finish us off with that,
We
Susan?
will. And it is getting late on Friday and we do want to go home, but it's important to debrief. The volunteer has had to do a lot of this support work during the week with Amber and Phil, and they're feeling a bit frayed about it. So as our organisation has a policy that you always have 2 workers on the ground if you're seeing people, so obviously there's going to be 2 of us there. And before we grab our bags and coats to go home as the vulnerable groups worker, going to have a chat to Susan, the emergency relief volunteer, and just say, how do you feel about all of that work you've done with Phil and Amber this week? And just maybe just go over a few of the positives that have come out of it and the good work that the volunteer has done, and where would Amber and Phil be if they hadn't come through our doors and received the support of the emergency relief volunteer. So it's good to just reflect on that, consider the positives that have come out of it rather than the negatives, and where to now for Phil and Amber, and that our door is still open to them, and they may and probably will be back next week, so don't worry about that. As the emergency, as the vulnerable groups worker, well, I've probably debriefed myself a little bit by going over that with the volunteer, but if I had felt that there was something more serious I needed to discuss, I might even, I might call on some professional debriefing. I might wait till next week and just talk to one of my colleagues, or I might even give my friend down at the domestic violence service a call and just maybe chew that over, have a coffee or something.
And Donna, you wanted to say something?
Yep. I'd just like to add, in a case like that, as the drug and alcohol worker, I'd be still feeling pretty optimistic about this family. They've engaged with some emergency help that's got them through a really difficult point, and they're clearly engaged because they keep coming back, and that seems to be one of the biggest things in predicting what's going to happen with someone in a situation like that. They've made contact with the drug and alcohol service. We know they've both got some contact with the GP for medication. So things can look pretty bad, or, you know, it can look like a bit of a crisis, but I think there's some really good work happened during the week, and I'd feel that this family's got every chance of getting there with continued support.
More optimism. That's great. Yeah, that's good. Now, we're about to move into discussion. I'm just wondering if any of our brilliant expert panellists have something they really feel like they need to add that you missed. I didn't give you the opportunity to say. There will be questions from the audience, so there might be other opportunities, but...
I think it's a bit of a well-known secret that quite often there is mental health outreach support as well. So what I would be thinking of for this particular scenario would be looking at different options for both Phil and Amber of being able to support them through this, not just through one service. So having other workers involved in it, and then having case meetings with Phil and Amber, etc., to try and help them move forward, and further support and activities provided for them. Because it's very lonely and sounds very isolated in what they've been through.
Yeah.
The only other thing I was going to say was that during the course of establishing her risk and immediate safety needs, I will have been doing the same for the baby as well. So I will have been thinking about the baby's needs in there. And at any point, my agency may be lucky enough to have a specialist children's worker on board, or we may not, and we may look for a secondary consult with, say, a child first agency in our local area or like that.
Okay. Thank you. I just want to thank you very much for taking my questions. I don't think there was a wrong door, was there? They got help everywhere.